Nigeria Medical Association Federal Capital Territory has decided to change narratives by giving back to society by strengthening primary health care and find out limitations that Minister of FCT will work on. Addressing pressmen during National Medical Association 2021 Annual General Meeting, Dr. Job Amadu said Minister of FCT was sad on the state of health in the territory and charged FCT chapter of NMA to improve on the status. However, Dr. Amadu charges government to improve on the drainage in the city center, also provide potable water and fortify primary health care in the center.
We are to strengthen the primary health care society. The leadership of Nigeria Medical Association, FCT, under my leadership, have decided to walk the talk. We know that when people mention medical doctors, the perceptions these days are different. But we have decided to change that narrative. We want to give back to society that which we have sworn an oath to preserve. And so NMA FCT wants to use this opportunity to let the world know that we are walking the talk as doctors and want to strengthen primary health care. We want to get experts to talk to us, and we'll get feedback from our colleagues who are also working in these various centers. What are our limitations? What are our challenges? How can we improve it? So that at the end of the day, we have a position paper which we are going to hand over personally to the FCT minister. Suffice it to say and mention here and now that he actually charged us to embark on this project. At our last courtesy visit to him, he was very sad the state of the primary health, the healthcare generally in FCT. He couldn't understand why, despite all the funding and support from government, despite all the remuneration being meted out to the healthcare providers, why we still have very poor ratings in the health sector. There's an increase in infant mortality. Of course, we knew how the COVID-19 ravaged us, even our health workers, and very lately, the cholera issue. So we are here to ensure that we take this feedback to the Honorable Minister of FCT and ensure that things are done properly for us, starting from the FCT, so that we can improve the narrative of the health sector. Our territory, which is supposed to be an urban city, is bedeviled with cholera outbreak anytime we're in this season. We all know that cholera is a disease that is waterborne, transmitted fecal-orally. And that means that whatever you put in your mouth, whatever you drink, whatever you eat, can be contaminated by the bacteria Vibrio cholerae. And when that happens, you come down with the disease. The simple basic thing would be to improve on, first of all, the drainage. If there's a rainfall, for instance, you find out that the gutters, the drainage system gets overflowed and the waters spill everywhere. And some of these waters is what is used to wash fruits that people consume. Even in very close areas, settlements within the city center, you find out that there's no proper toilet facilities, no good potable water. And by the time you have contamination of all this, what you consume, people come down with this disease. So I charge the government to, first of all, improve on the drainage in the city center and to ensure the provision of potable water in the city center. And then at the same time, to fortify the primary health care centers, which is where most of these people go to seek health service, and which is one of the theme of this annual general meeting, to fortify, to strengthen the primary health care center, and ensuring that the basic infrastructures within the city center are provided. COVID is still very much with us. COVID is not over, but I can say on good authority that we're able to contain it because of the response of government in providing the vaccines and the acceptance of the vaccine by people to go to collect the vaccines. I hope you have collected all your